Americans could soon face a major increase in the cost of their health care coverage as key federal tax credits are set to expire. Without an extension, more than 22 million people are at risk of their health insurance premiums doubling.
This could force families to reconsider or drop their coverage altogether. Joining us this morning is Vice President of Economic Security Project, Adam Rubin, to talk about what it means for you. Adam, good morning.
Good morning. Thanks.
Thanks for joining us. Let's talk about this. What's changing this fall in the healthcare landscape, and why does this mean potentially much higher costs for families?
Health insurance costs could double or even triple this fall for tens of millions of people, and most of them don't even know it yet. People who buy their own health insurance generally get it through the Affordable Care Act marketplace or Obamacare, and they usually get tax credits that help lower the cost of the insurance. But the big tax bill that Congress and the president passed this summer allowed those health care tax credits to expire. So that means skyrocketing prices at the end of this year and millions of people who can no longer afford their health care at all. November is the start of open enrollment. It starts this Saturday, where people sign up for healthcare for the next year. They can find out what it's going to cost. For most people, terrible sticker shock, as we see the largest ever premium increases, and families who are already struggling with housing, utilities, groceries. This is one more thing that's going to cost more.
Yeah.
Well, so how is this going to affect people here in our neck of the woods, in Oregon? How is this going to affect individuals and families here?
In Oregon, the average premium increase is $772, and 210,000 Oregonians are slated to lose their health insurance due to the cuts in the Affordable Care Act and Medicaid. But in some cases, it could be worse. Take a 60-year-old couple. They're working. They're making $40,000, $45,000 a year each. They get a basic health insurance plan. The cost of their health care bill could go each month from $685 to $2,198. What kind of middle-class family can afford that? And it's all worse because the same bill will force hospitals and clinics to close or to cut back services like maternity wards, especially in rural areas. So we'll see folks skimping on the necessities and skipping healthcare they can no longer afford.
Wow. So who is most at risk of being affected here? And do these impacts also apply to people who don't get their insurance through ACA or through Medicaid?
Yeah, if you're on the ACA or the Oregon Health Insurance Marketplace, you'll look to see your premiums roughly double. About half of those folks work for small businesses or own them, or they're farmers or freelancers, or they're in construction or restaurant jobs, for example. But what happens when someone can't afford their health care and they get sick? They end up in the emergency room. So wait times increase. Hospitals pass along the cost to the rest of us. Health insurers jack up the premiums so they still keep making profits. So no matter where you get your insurance, these ripple effects are likely to hit you too.
So what can we do? What can be done about this? And if you have any other questions, to educate yourself, where can we go to get more info here?
I think the good news is these premiums don't have to increase. Congressional Democrats right now are insisting on extending the tax credits to keep costs down. Republicans in Congress, many of them are refusing. That's what's behind this government shutdown. But a number of Republicans, an increasing number, are saying they're concerned about the price increases on folks in their community. So I think the hope is that we can get the leaders of both parties together to sit down and reach a bipartisan deal to extend these tax credits so that we can make sure that health care is a right in this country and not a luxury. And folks can find out more by going to healthcare.gov to find out the premiums and more information in their area.
Okay, Adam, we appreciate the heads up. I think this is going to be a big topic of conversation next month as that sticker shock faces many, many Americans. We appreciate it. If you want to learn more about the impacts and how healthcare costs could be changing for you, you can also check out this story on coin.com. It is 7:22.